The identification of the EGFR mutations in a subgroup of patients with non-small cell lung cancer that are mainly represented by never smokers and light smokers changed completely which were the expectation, the survival expectation in stage 4 non-small cell lung cancer, because having this kind of sensitizing mutation, this kind of in the tumor, these patients are getting a huge benefit by receiving in front line one single pill that could be erlotinib or gefitinib. And this information was generated through a series of randomized clinical studies, at the beginning using clinical enrichment factors, like for instance the ethnicity, the never smoker status, the female gender, and the diagnosis of adenocarcinoma. And we got a couple of phase 3 studies that showed a huge improvement in PFS for the patient who were treated frontline with the epidermal growth factor TKIs. And then in a second phase, other randomized clinical studies, some of them just presented a few months ago, in a highly selected population, in other words, in a fully genotyped population, having this kind of mutation in the tumors, again we saw a huge improvement in PFS.